So I'm talking to Jim and Tim a couple months ago, and they said, do you believe in free speech? I said, absolutely. They said, good, you're going to give one in Atlanta on April 26th. So here I am. And I'm going to start at the back of my remarks instead of the front, and then I'll explain why. There is a future for the independent physician office practice. So in our view, that's the good news for you today. People like PSMA are helping you reduce costs, but I also want to talk about not just I don't want to talk about reducing your costs. They've already got that under control. I want to talk about how do you increase the revenue into your office practice. Also, I just saw last night that there is a projected shortage of primary care physicians of 120,000 in the United States by the year 2023. That's a lot of doctors. So the independent physician practice can be alive and well. And just like the mantra of PSMA of caring for the caregivers, my partner, Maurice Reifman, who's been in the medical billing business for 35 years, mantra is to provide physicians with a more rewarding day. And that's also a big part of not only survival, but also having a good time. There's a great new book out called The Patient is the New Payer. And that revolves around, it's about the history of medicine and the history of healthcare in this country going back 100+ years. But it also talks about the trends of what is happening. And so, and nobody talks about the big insurance companies. And I'm not going to talk about the big insurance companies, so I don't end up with somebody sitting on my front doorstep with a baseball bat when I get home. But the old model 50 years ago of how healthcare was delivered is if you build a triangle, and at the top of the triangle was the patient. Next came the doctor or the hospital or whatever provider. In those days, when I'm like Chris, when I was growing up on the farm, the doctor would come see us unless we needed stitches, which we probably had the same kind of childhood. I needed stitches all the time. But he'd come to our house. And then lastly, on the pyramid were the insurance companies. Today, that model is turned upside down. The insurance companies are at the top and the patient's at the bottom. And our mission with our company called the Healthshare Plan, and if you want to look at us, you can Google healthshare.fit, and you'll see what we're all about, which is the 25-year-old caring, health sharing communities that actually go all the way back to Ben Franklin. So healthcare sharing has been around for hundreds of years, and we are back to that model. So a very important part of running your office practice on a go-forward basis, and this is a stunning statistic that I don't know if any of you read London-based Financial Times. It's a great business newspaper, and they have occasionally put out a magazine. This is called Health at Work, and it talks about the trends of what employers are doing and sort of the kind of things that Chris talked about with Mohawk. But they did this one, and the quote by the editor, which I'm in this business, and I was stunned by this. We know well the importance of factors like healthy diet and physical activity to our long-term health. For example, for someone who exercises versus someone who doesn't, you can expect 11 years more life. You can expect to spend 6 fewer years ill. Your total life healthcare costs will be 21% lower. Wow. That is, I find that to be an incredible couple of statistics. So how does that impact your practice and what's happened? Half of the independent doctors are gone. I forget that, 44%, I think was what Chris had said. But, and what we see of what doctors coming out of medical school today, they're not primary care physicians. They have a lot of debt. And with what primary physicians are paid today, we are involved with the New York State Society of Family Physicians, and the average take-home pay in New York which is a very expensive place to live, is $156,000. So if you're going to educate a bunch of kids and that's not a lot of money for the opportunity to work 80 hours a week. So how do we change when what's going on? And we are all aware of what Uber has done to transportation, what Airbnb has done to hospitality and lodging, what the airlines have done, where you don't talk to a travel agent anymore, you do it yourself. And so where and how does that affect physicians' office practices on a go-forward basis? Telemedicine is here. You don't need to be available for 24 hours a day, 7 days a week now. You can partner with telemedicine. They are all board-certified physicians, and we use them, and we think they're terrific. And so that's one of the changing ways of how your practice is going to operate. So how do you increase the revenue of your office practice? Well, most of you today, and it depends on what state you're in, and if you want to see what's going on, you can Google this and get this map, which shows us what the exchanges are charging in each state and what the increases were for January 1, 2019. And we then try to target a lot of these states, including, I know North Carolina is one of the states where the prices have gone up a lot. It's how we met Tim originally, with his personal story that he had a personal family crisis of cost with the provider in North Carolina, who I will not mention, but you all know if you do business in North Carolina who that is. And so that's what we're trying to do. We want to get rid of the interference that exists between your physician and your patient. So we want the quality of that relationship to be between the doctor and the patient, no interference with insurance, no interference with other means of keeping your doctor and the patient. And that's the relationship we want to build on. Because the way to health, which that statistic in the Vitality magazine is that, and my partner Maurice says, you should talk to your primary physician every day, preferably after you brush your teeth, look in the mirror. You are ultimately your primary care physician, and you should pay attention to all of that's involved in your health. One of the problems the doctors have, and it's all about the electronic medical records, and you go see your doctor, he or she sits on a stool, probably with their back to you. They engage, but they type, and it's been detrimental to the quality of the relationship between the provider and the patient. The other problem is the networks that have been created, the vast variety of networks that have been created, where you don't know the doctor. And if you were part of an exchange program and you look and you see that you need to have a minimum essential coverage, which is the ACA compliance issue, there are 71 preventives, and those 71 preventives have to be provided as part of the MEC, minimum essential coverage. Boys have a list, girls have a list, kids have a list. And we believe that that is the first step toward getting you to pay attention to your health. And if you go to the national, we had huge complaints when we first got started of people going to doctors they didn't know. They knew they were going to see them once. There were communications barriers. There were cultural barriers, and people started complaining to us. So we said, okay, go to any doctor you want for your MEC. Go to your own doctor to get your MEC. That solved the problem. And we said, okay, we will pay 100% of those preventatives because we want everybody to go have the preventatives. And that is the first starting order of somebody measuring your health and where you are on the benchmarking of what data they have, or starting with benchmarking yourself on where your numbers are. So we said, okay, in order to encourage your doctors to give you the kind of time that it takes to really determine the physical condition you're in, we will pay your doctor 1.5 times Medicare for those preventives. We will also pay 1.5 times Medicare for illness or accident. And we've simplified, if that's possible, down to what medical care is. In our view, it's preventive, and then it's illness or accident. And illness and accident will pay 1.5 times Medicare as well. How does that help you and your practice? Well, today, your physician, depending on the state, your physician probably gets, for procedures, probably anywhere from 0.6 to 0.8 times Medicare for a rate to provide everything or whatever you need. We believe that by paying 1.5 times Medicare, the doctor will spend more time with the patients because they can afford to and they want to, and that building that relationship is critical. It also increases the revenue to the office practice. So on top of that, what we're suggesting to the office practices is introduce our Healthshare plan to your patients, because all the patients that come to you as part of the Healthshare plan, the doctor's revenue goes up because we're paying twice what they're getting, what you're currently getting from the major insurance companies. We don't do copays. We don't do coinsurance. We don't let them balance bill. We will fight those fights for our members that no balance billing. The largest cause of personal bankruptcy in the United States today is medical debt, and it's billions of dollars, and it's ridiculous, and it's not right. And $4 billion of that are with our veterans, which is really a travesty in my opinion. So we're working with an organization on the whole issue of how veterans, 80% of veterans don't live within 50 miles of a VA hospital. So we're trying to work on changing that whole situation, and Jim's involved with us and a company in Colorado about that. But increasing your revenues, increasing the relationships with your patients, adding to your patient base. And I know some of you probably have a heavy Medicare-based population already. That we can't do anything about. But the idea would be that you increase your base with new patients, younger patients, and people who care about their health. And there's a lot written today, and there was just an article in the London Times. Patients take control of their medical data. You see these ads of Fitbit and collecting data and how many steps a day do you walk or run, and where's all that headed, and what are we going to do with all that data? We collect data. So for our clients, if you submit your stats every month, height, weight, resting pulse at vigorous exercise, and how many times a month you exercise more than 30 minutes, we will pay you $10 a month for that data. And we pay it quarterly. And then it's anonymous, but we're collecting our own database on how encouraging our members to exercise and whatever exercise means to you. Exercise means a lot to a lot of different people. There's now I don't know, but I guess it's medical evidence, but it's more scientific, I think, at the moment. But if you've had a lifetime of exercise, they now believe that later in life, if you've had a life of vigorous exercise, there's a foldover. In other words, it stays with you, and it's like an after effect as you get older, which is a very valuable thing. And it's the use of oxygen, and it's how you process oxygen, and keep moving. And everywhere you pick up an article about exercise, it's keep moving. That's the magic. I want to touch on Medicare for all. Several of the Democratic presidential candidates are talking about Medicare for all. And my first question for all that is, who's going to give up what? Pick. The doctors have already been beaten up on by the insurance companies and how much they get paid. So the doctors took the blow first. The hospitals have not so much. Certainly big pharma and the insurance companies have not taken the hit. So where does it go? If it's Medicare for all, who's going to pay? And oh, by the way, the rapid consolidation of hospitals in this country, where the rural hospitals are really at risk today because they just don't have the financial clout to compete. But interesting fact, every congressional district in the United States has a hospital. Who in Congress is going to lose an election by losing the hospital in their district? The answer to that would be nobody. So I don't see Medicare for all happening. President Trump's actually helped us. He's approved the creating associations. You can create associations. On ours is called Healthshare.fit association. And all of our members are automatically members of our association. That's a possibility you can help organize in your neighborhood for people, depending on your demographics and where you are. But getting your doctor to be more engaged, or you as the office practice manager, getting engaged with some internal marketing to your own patients about here's an alternative to the high cost of an insurance company with a big deductible. We only have 2 deductibles, $500 and $1,000. You're limited out to 3 per year, and there's no deductible after that. And how can we be so much cheaper than anybody else? Well, we don't have legacy systems. We don't have lawyers on top of lawyers to fight with 50 states because we're not insurance. So we don't have the regulatory issues that the big insurance companies have. Our CEO doesn't make $20 million, unfortunately, but he doesn't. And so there are a lot of things that we don't spend. If you really were to dig down into what are the costs of running a major insurance company, 44 cents of every premium dollar is administrative expense. Reporting on top of reporting. 44 cents of the 3 trillion, 44% of the $3 trillion health insurance industry in the United States is poof. The actual payments for medical bills paid out of every premium dollar is 22 cents. And most of that is I forget, Chris, what you said, 5% of Americans use up 50% of the of healthcare. So we're all about helping your independent physician practice increase your revenues and how we do that. And Tim's here to help you decrease your cost. So we believe the independent physician practice is going to be alive and well for a long time. And people trust you. Your patients, for the most part, if you know them, they like you. And that's a big part of healthcare is the whole trust factor. And we know that it's an emotional thing. If you get sick, it's trauma and it's dramatic. And the more you can trust your doctor and know them well, the faster it is for you to heal. So I'd love to have some questions.
Well, thank you, Sandy. And a big part of the reason we had Sandy kick this off, and we got this from a lot of members, what's one of the top issues that you're facing? And again, it's figuring out a way to help our employees and our staff with the rising costs of commercial health insurance. There's kind of 3 buckets. You're in the exchange, which has gone up, 12 to 30%. I think Maryland 31% increase last year.
North Carolina 100.
North Carolina, yeah.
South Carolina 100.
So continues to go up there. You're either in some type of a group plan, a spousal plan may not be good. The family all-in deductibles are $12,000, $14,000 a year now, or you're bare. You don't have any coverage. So one of the reasons we want to kind of kick off this is because this is a significant pain point. We've talked to so many groups and they're just not doing anything. They don't have a solution, and this is a viable solution. So just maybe by show of hands, how many of the practices here are actually providing some type of a group plan for their employees currently? Okay, so we've got half a dozen or so. Okay, how many don't provide?
How many are happy with what they have?
Well, yeah, let me get to that. So how many are not doing anything for the group currently? Okay. Have the costs, show of hands, costs continue to go up, whether you're in a group plan or not? Okay, so pretty much every, well, some of you. So the Healthshare plan, I'm going to throw this back to Sandy. It's different, but at the same time, this is where medicine used to be, right? So you're pooling risks with like quality patients, right? Ones that are, trying to stay fit, trying to stay healthy, that have accountability for their own health. Now, I know some Healthshare plans out there have a very low cap on what's allowed to be spent, right, on their healthcare issues. So maybe comment on the cap and then who gets into the program.
We have, before I answer that, I forgot to mention, you have a new problem coming down the road that you may not have considered. And that is, there is a war on talent in this country. The shortage of trained medical people, the unemployment rate being very low, you're going to have a war on talent. And we're working with a very large technology company in the Midwest that provides human resource plans for large companies. And they have 11 million people on their platform. And they have contracted with us to be an alternative to COBRA and an alternative to what's available when people leave those companies and are on their own because they want to start their own business or because they want to do something else. And they said the war on talent is significant, and the answer to getting who you want to work for you is providing health benefits. It's a real problem, even among millennials who are impervious to anything going wrong. But once you start a family, you get more sensible about what your needs are. But it's a big deal. So what was the question?
Cap? Was there a cap on there?
No, we don't have any caps. We have no lifetime caps. So if we have prohibitions on joining our program if you have had a stroke, a heart attack, cancer, or diabetes 1 within the last 3 years, but then you're free and clear. You can still join the plan. We take everybody as enrolled. We have an enrollment form. We don't have a application form. The enrollment form asks you a lot of questions. If you smoke, we charge you an extra $75 a month because we know the evidence on the problems dealing with smoking are major. But if you are free and clear and you join us, and then at some point you have a major problem or you develop a chronic disease, you're with us all the way. We can't get rid of anybody on that basis. Yes, ma'am.
You said you were talking about deductibles, and you said you have 3. You can explain that.
2. You can either we don't call it a deductible because that's an insurance term. We call it a personal responsibility. You have either a $500 personal responsibility or $1,000.
Okay.
That's it.
And but is that paid like per occurrence or?
It's per event.
Okay.
Preventative's free, so that's not an event.
Right.
So mammograms, colonoscopies, children's immunizations that we reimburse you 100% for those.
Okay.
So people say, well, wait, what do I do when I go to the doctor? Where's your insurance card? I don't have an insurance card. I'm part of a health sharing plan. And we spend a lot of time talking to doctors' offices until they get to know us because the people at the front desk say, well, wait a minute. Hi. And you say, I'm a self-pay patient. Here's my credit card. Now, depending on why you're there, you never part with more than $500, no matter what's wrong with you or why you're there. Or even at the emergency hospital, and you say, bill me. So, and that's how it works. And then 3 times, if you're a single or a parent with child, it's 3 events a year. If you're a family of 6, like Tim, it's 5 events a year. So one critical part of doing an analysis on an health insurance offering is what we call MOOP, maximum out-of-pocket exposure. And maximum out-of-pocket exposure for some people, we have the endorsement of the American Association of Birthing Centers. We love midwives. There's so much evidence that midwifery delivers really healthy babies. And if you think about it, hospitals are bright lights and noisy, and babies much prefer the quiet venue of a nurse midwife But I called this woman in who asked me to call her in Arizona. She said, your prices are high. I said, what? She said, I have a husband and 4 children, and you want me to pay $985 a month and I'm only paying $350 a month now. I said, well, wait a minute. Where are you paying $350 a month? And she told me, and it was Arizona local exchange, run by one of the bigs. We call them the BUCAs, Blue Cross, United, Cigna, Aetna, Humana, et cetera. I said, well, what's your deductible? She said, $6,500. I said, per person? Per person. I said, well, this was in November. I said, God forbid you're on your way to grandma's house for Thanksgiving, but if for unknown reason, you're in a major accident and all 6 of you end up at the hospital, do you understand that your personal out-of-pocket exposure with that plan is almost $40,000? And with our plan, that you're done at 2,500, 5 times 500, 5 events times 500, and you're done for the year with us. Oh, really? That's how that works? That's how that works. So a lot of people who are not paying very much every month are looking at anywhere from $6,500 to $10,000 deductible with all kinds of, you got to be in network, and it's more if you're out of network. So we don't have a network. You bring any doctors you want to us. We want you to have the doctor of your choice. And then when you need a specialist, our experience is we want your doctor who knows you the best to recommend which specialist, depending upon what condition you have that needs attention. So this is all about giving the power and responsibility for your health care back to you. People don't understand the power they have to help negotiate what things cost. We partner with a company in Texas called Sedera, Sedera. They do all of the medical bill negotiations. They've been doing it for 25 years with their parent company. And in 2018, they averaged a 48% reduction off of medical bills that were submitted and satisfied completely. So no balance billing to you, the patient. And they achieved 52% reductions in 2017. And those are the latest numbers we have. But it's negotiable. We haven't, but they've had 3 neonatal intensive care unit babies called NICU. I never get the words in the right order. And those bills were $1 million a piece. They settled each of those cases for under $200,000. So you read these crazy things. I talked to a guy who had brain surgery, and he said, oh, you don't want me. I cost the insurance company $750,000. I said, excuse me, no, you didn't. Nobody paid that bill at $750,000. So it's all manageable. We want people to take control of their health care and take it back, and we want your doctors to help in that process and increase the revenue for the office practice. That's the plan.
So Sandy, many practices are utilizing part-time staff and job share type programs. A, because of the tight labor market. B, because of the costs associated with full-time staff. Is the plan only available to full-timers?
No, part-timers. What we originally had the idea when the ACA was passed, and we read it, most of it, probably more than Nancy Pelosi read, but it was obvious that the ACA, the Affordable Care Act, disenfranchised independent contractors, small employers, franchisees, licensees, young professionals. And we went, wow, that's the market we'd love to have. Those people are great. So we love part-time people. We love independent contractors. We love young people. The most business we have is from gyms. We have a ton of gyms, young people who are fit, but you can, I know you get a lot of broken bones, but you know what? You can buy truckloads of barrels of plaster of Paris and not go broke. Why you go broke is chronic diseases. The Mayo Clinic says 70% of Americans take at least one medication, one prescription medication. 25% of Americans take 2 or more prescriptions. That's not good. That's really not good. We need to, and so we need to get, better.
We're going to open up some questions here. We got one starting here from Michelle.
How do you address mental health, addiction treatment, behavioral health?
Excuse me, Jim, I didn't hear that. Would you throw her out of here? I've known Michelle a long time. So that is a very difficult question. And you won't read in anybody's guidelines how that happens. So Sedera is a very Christian organization in the sense that they don't make a profit on the money that we pay. That they get a certain amount of money to adjudicate the bills. We get a certain amount of money to run the whole program. If there's profit, it goes back to the members. So there's a lot of, okay, how do we deal with this and what's covered and not covered? You won't see in our guidelines a definition that's black and white on how to deal with mental health care. We deal with it one case at a time. We want a doctor to say, Michelle, we think you should, see somebody about this issue. The whole issue of addictions and opioids and the problems of all those in this country, we're dealing with as best we can. If I give you a definition, I'm then stuck with that answer depending on somebody who comes up and says, look, I need this, I need that. And so we just deal with it. If somebody comes to us and says, okay, I am in therapy and have been for years and it's paid for, I say, stay where you are. Same thing with diabetes 1. I've learned more about diabetes 1 than I ever cared to learn. It's a very serious life condition. It requires constant management by you, the patient, and your providers. And if you are happy with how that's working, don't change to us because it's not worth the money.
Is it safe to say, Sandy, and I don't want to presume, but if it's an accident or illness related and that becomes part of it, whether it's opioids or whatever, then it would be covered because those are?
Yes. Now, we have the right in our guidelines that if you are in a automobile accident and you are convicted of a DUI, driving while drunk or under the influence, we can deny coverage to that. Same with if you're drugged up and you're in an accident, same problem, same issue. So we want people to take personal responsibility for their health.
Right. We had another question over here.
Yeah, about this plan, Healthshare looks pretty exciting. My question is, how is you're going to reimburse? You reimburse the patient, the member, or the provider? Like, patient comes and he pays upfront to the doctor, then you reimburse your member, or you send the check to the doctor's office?
No. Yeah, part of that's true. We only ask you to pay. Excuse me. We only ask you to pay the first $500 of whatever you're there for. And we will reimburse you for that in 2 weeks. There are a lot of people that don't have $500 laying around. As a matter of fact, I think it was the Cleveland Clinic that had this study that said 47% of Americans don't have an emergency $500 available. It's frightening. That's scary. So we know we want everybody to have their own skin in the game. So you pay the first $500 and we reimburse you right away if it's on a credit card before the credit card's due. Now, a lot of doctors' offices will bill you and you don't have to put anything down, but that requires some training that they have to know who you are. I mean, you can't just walk in there and say, bill me, give me this test and then bill me. The other thing we say to people is don't pay for lab tests. Make them bill you, and we want a detailed bill of the lab test because a lot of doctors' practices share a building, and so the lab gets created by several different doctors' practices that are in one building. This is mostly in urban environments, of course, and so they want to take a lot of tests, as many as they can. So my dentist, and I live in New York City, and my dentist has 4 women who work for him, and we saved him $25,000 just like that. One of the women needed some tests. I said, Helen, don't volunteer to pay the labs. You want to be billed, and you want a detailed billing. She went to the lab and she said, I'm a self-pay patient. They whipped out a pre-printed sheet and said, you get 70% reduction off the cost of your labs as a self-pay patient. And I said, wait a minute. Well, because they want to bill the big insurance company $100, and if they get 30 back, they're happy. So Helen, pay us 30. So that's the game. I mean, the game is, the game is the game, and it's not a pure game. So
if I have this plan, I just present as a self-pay patient to my doctor and pay him upfront. Like that's the way it would work. Like
I think you had sepsis. No, what did you just say?
But I'm saying, like, when I go to the doctor, I should tell the front office I'm a self-pay.
Yes.
They bill me, and then I forward that bill.
You submit the bill. So if it's under 500, you pay that bill yourself and send us a copy of it so we can make sure you get credit for an event. If you're in an accident and you're in the hospital and it's serious, we don't want your family to be troubled by helping you get better. We take over the whole process in that case. You don't have to worry about anything. We'll take care of it. And then we'll give you 500 less back. But we don't pay the doctors in the hospitals directly. We would in the case of a serious accident where you're really not capable of or shouldn't be put under any kind of stress. But we take it over and we reimburse you, and then you pay the doctor in the hospital.
Okay. Thank you.
Yeah. Yes.
Some other questions over here? Great. Here, let me give you the microphone. Yeah. Thanks so much.
So do you basically pay a premium to your company every month, and then you're still responsible for the first 500?
Yes, it's a monthly subscription, and it's anywhere from, if you're under 30 years old, it's $285. If you're a family of 4 to 6 to 8, it's Tim, what do you pay a month? $1,300, and it's age banded. So if you're a young family, it's under $1,000. If the lead person, in this case the father, so they're $1,300. I think that's the highest. That's the highest band we have for a family.
Well, the key thing is, as Sandy says, a maximum out of pocket. So most people think, it's not going to happen to me, right? It always happens to other people. And the next thing you know, there's a car accident or some surgery that comes up, or heaven forbid, cancer. And then you start realizing how your policy works, which is, $14,000 deductible for, all in for the year. So as Sandy was saying, and I think Kaiser Foundation did a similar study, majority of Americans don't have a couple $1,000s set aside. And, insurance companies are relentless at collecting, right? So those are large amounts of money that you'd have to contribute to that. What other questions do we have around the room here? I'm going to ask one question. Take your time answering because I need to figure out the technology up here again. Okay. So for enrollment, talk about enrollment and why you don't have an enrollment period.
Why what?
Enrollment.
Oh.
Enrollment.
Okay. We don't have an open enrollment period. It's all the time. So you don't need to bother with the end of the year. You can leave. People say, well, but I signed up for the year with Blue Cross United, whoever. I said, you know how you get out of that plan? Don't pay them next month. You're out of that plan. So it's very simple. That contract means nothing. Those contracts are for the benefit of those insurance companies to think that you're for sure going to be with them for a whole year because you have a contract. Don't pay them in a month and see what happens. Boop, you're gone. So then you can join us. Yes.
You had mentioned going back to your porch and the baseball bat. Has any large payer arrived at your doorstep and your checkbook and say, let me take you out?
They haven't yet. And I think there are 2 reasons. One, they have no idea how to handle our population. We are individuals, families, small employers, small physician office practices, gyms, which are all independent contractors for coaches. And so until the day comes when they would know what to do with us, but eventually that day is going to come. And both Maurice and I are not spring chickens, but we're bringing in younger people to run the company, and we would have a personal moral dilemma if we were to sell this company, because we would be leaving all the people who've trusted us to have access to the best doctors they want to have at the lowest prices. If we were to sell the company to one of the bigs, that would be, in my opinion, we would be morally bankrupt if we did that. So let's hope we have that challenge of how we're going to perpetuate it at some point. But no, we think that we're on the right side of angels in this kind of approach and what we're doing. And we are helping people. And we actually, if you go into our website, there's a testimonial from a young woman who owns a CrossFit gym in Pleasantville or Pleasant something, Michigan. And she got pregnant, and she had a nurse midwife to help her. But about 7 months into the pregnancy, the baby contracted something that's a word that's about that long that I never remember how to pronounce. And so they into the hospital and engaged the doctor. And then the baby ended up with jaundice, and she ended up in a week longer. But up front, Susie said, what do? I go to my doctor, ask him what he wants for all 9 months to do this pregnancy and the delivery. So the doctor said, well, why do you want to know what that number is? Well, because we're going to pay you. He says, now? She said, yes. It's about 3 months in. He said $14,700. Gets a check from Sedera for $14,700. So everything's humming. This is the perfect system until the baby gets this problem. And then there's all kinds of other expenses. But she's saying, don't you dare give me tests that I don't need, because I'm a self-pay. Don't you give. And so I'm saying that's what we're talking about, is empowering our people to take control of the delivery of healthcare to you. So all that turned out great. And she's like a raving fan for us. So.
Well, Sandy, we appreciate you coming here from New Jersey / New York, and let's give it up for Sandy on the information you shared with us.